Knock, knock, knock. Hello, I am Jessica. I'm the student nurse. And how are you doing today? Oh, good. I'm going to be doing your nasogastric tube. Can I please see your wristband? All right, and your date of birth and name? All right, thank you, Tiffany. Can I call you Tiffany? All right, thank you, Tiffany. So what we're going to be doing today is, I know you're having trouble swallowing your food. So I'm gonna put a tube through your nose and it's gonna go down into your stomach so then we can get you nutrients. It's a fairly quick procedure. It does not hurt, it's not painful, but it is a little bit uncomfortable. If at any time during the procedure you're just needing a break or anything, you just raise your hand and I will stop right away. All right, do you have any questions for me before we begin? No? Okay, well, great. I'm gonna go gather my supplies and wash my hands and I'll be back to do the procedure. Thank you. So I washed my hands, grabbed the supplies, knock, knock, knock. I shut the door and I'm shutting the curtain because the patient shares a room with another patient. All right, hi Tiffany, I'm back. So I got my gloves and we will get started in 1 second. Okay, so I brought you a glass of water in case you want to take some sips while the procedure is going in place. And I brought the tube and syringe to do the gastric content to make sure. Tissue for your face, the lube for the tube, gauze for the tube, pH strip, and the tape. So the first thing I'm going to do is I'm going to measure the tube to see how far down we have to get it to your stomach. So I'm going to put it in front of the patient's, in front of Tiffany's nose, and it's going to go to her ear, and then it's going to measure from there to the styroid sternum. And that looks like it's at 60 will be the number. So I will write that down that it's going to be ended at 60 or put a little marker, piece of tape right there. So I guess I'll put a little piece of tape. But it is marked. So put it right there. Okay, so Tiffany, I have some spray for you to numb the back of your throat that your doctor prescribed. Would you like some of that? Okay, let me spray the back of your throat. And it is numb now. It's been a couple minutes and it's nice and numb. Okay, Tiffany, so I'm gonna just insert this into your nose, and like I said, if you feel uncomfortable in any type of way, you just raise your hand and we'll stop. All right, so I'm gonna lift up the patient's nose, Tiffany's nose, and I'm gonna insert the tube all the way completely back, and then I'm gonna push down so it goes down the esophagus. I'm gonna keep going until at a slow pace. Tiffany, would you like some water? No water? Okay. Is that okay? Are you handling it okay? Comfortable? So we got to the 65 now. You did great, Tiffany. So I'm gonna take the tape and I'm gonna tape that off where the tube is inserted, and tape that off really well because I do not want the tube moving at all. You did really good, Tiffany. Great job. So I just want to let you know that was the procedure is over now, and I have it taped off, and I wrote down where the tube is at. It's going to feel uncomfortable for a little bit until you get used to it, but within like a couple hours, you should not even notice it's there. So I'm going to just make sure I have it in your stomach placed correctly. So I'm going to just take out some of the stomach content. So I'm going to insert the syringe and very slowly pull out some of the stomach content, and then cap that off to wherever I would cap it off to. And then put it in the jar, test it. It should be at 4 pH or under, and it is that, so that means we have correct placement, which is awesome. So I'm gonna clean up my area and give Tiffany a tissue to wipe her mouth or face or whatever she would need, and her cup of water, and take off my gloves, wash my hands, And then Tiffany, thank you, you did great. I'm gonna go document, and what I'm gonna document is the patient consented to the nasotube, that I inserted the nasotube, the time, the date, the measurement that was 65 for the tube length, and then giving okay for the patient to be fed through the tube if the placement was correct. And I think I said what the pH was. So I think that's it. All right, thank you.